Hello everyone, my name is Obo Felicity Ituan, a fellow of Caregiver Nigeria Society. Today we are here to talk about the effects of alcohol and smoking in pregnancy. During pregnancy, some risks are easily overlooked, but these risks can cause serious effects and harm to both mother and baby. Smoking and alcohol are two of those risks. It's not just about the direct use, but secondhand smoke can harm both the mother and baby. Many people believe that small amounts of smoke is good, but the truth is it affects the growth, development, and overall well-being of your child. In this video, we will explain the effects, the risk of exposure to secondhand smoke, and how to prevent or manage this during pregnancy. Let's walk through it together. Pregnancy is a critical period of development for the fetus, which is a very critical period which has to do with the growth, development of the fetus in utero, and the lifestyle choices you make have impact on the health of your baby. Smoking and alcohol consumption are the two common habits that could have detrimental effects on pregnancy. Effects like miscarriage, stillbirth, preterm delivery, and other complications can result from too much consumption of alcohol during pregnancy. As a pregnant woman, it is advisable to abstain from alcohol, smoking, not just direct smoking, but secondhand smoke from your environment. Avoid alcohol and substance abuse in pregnancy. Substances like herbs, which shall not be prescribed or healthy for your baby, drugs, over-the-counter drugs or over-the-counter medication could cause severe harm to you or your baby when not be prescribed by your physician or healthcare provider. Smoking, drinking of beer, alcohol are harmful to the health and development of your fetus. Effects of smoking and drinking in pregnancy. One, we have miscarriage. There is an increase in miscarriage, stillbirth, preterm delivery, and sudden infant death. This could result due to excessive smoking, drinking of alcohol during pregnancy, especially at the early stage, which is the first and second trimester of pregnancy. We have low birth weight, reduced fetal growth, and low birth weight. Due to the fact that you are always smoking and drinking, it restricts the growth of your baby in utero. We have premature birth, which is increase the risk of preterm delivery and preterm labor. You can go into labor when it's not yet time for you to deliver due to the effects of alcohol and smoking, most especially drinking, which is alcohol. Not just alcohol, taking unknown substances such as herbs can also have effects on your baby. And we have birth defects, increased risk of cleft palate, heart defects, and other birth defects. This could result due to too much consumption of alcohol and smoking. Having fetal abnormalities during pregnancy can be as a result of too much consumption of alcohol and smoking. We have placenta problem, which could be placenta previa, placenta abruptio, and placenta insufficiency. We have fetal growth restriction, retarded fetal growth and development. Due to the consumption of alcohol, there is limited or restriction of the fetal growth in utero. Then we have increased risk of pregnancy complications such as diabetes, hypertension, and preeclampsia. Diabetes, like we all know, can result due to high sugar. Taking too much of alcohol, which contains sugar, could result in diabetes in pregnancy. And lastly, we have neonatal ascent syndrome, which is withdrawal symptoms in newborn. Risk of secondhand smoke and passive drinking. Secondhand smoke, increased risk of miscarriage, low birth weight, and premature birth. Too much consumption of alcohol and smoking could result in these conditions. It can also lead to restriction or low developmental rates of the baby. As a pregnant woman, it's not advisable to consume alcohol during pregnancy. Not just alcohol, unknown substances, smoking can have serious effects on your baby, which can lead to abnormalities. Then we have 2, passive drinking. Increased risk of FAS, which is fetal alcohol spectrum disorder, and other alcohol-related effects. Management of smoking and alcohol in pregnancy. Quitting smoking and alcohol in pregnancy. One, we have NROT, which is narcotic replacement therapy, safe and effective for quitting smoking. Then we have two, counseling and support, individual counseling, group, support group, and hotlines. This is very important for a woman that wants to quit smoking, especially if the woman has been smoking and drinking before being pregnant. She will need to undergo counseling on how to stop. Alcohol addiction is not what you stop in one day. You have to undergo some therapy and counseling, and also you can do the counseling in groups so that you will learn from your peers who might have been in such condition before. Then lastly, we have alcohol treatment program, professional help for alcohol addicts. You will seek professional help such as therapists in order to undergo treatment for your addiction for either smoking or alcohol, in order to have a safe and healthy baby during pregnancy. Prevention and early intervention. Preconception counseling. Education and counseling before being pregnant. As a lady, you are addicted to smoking or drinking. Not just being addicted, or you smoke as a lady, you drink as a lady. Before undergoing pregnancy or before you conceive, meet your healthcare provider for counseling and education. 2. Early prenatal checkup. Regular prenatal checkup and monitoring. Attending your antenatal classes, which is very vital and important. And lastly, we have screening for substance abuse, identifying and addressing substance before pregnancy or during pregnancy early. Substances such as smoking, drinking, or no substances which could be in form of herbs should be identified early in order to have a safe and wonderful pregnancy journey. Smoking and drinking during pregnancy could result in serious effects, but the good news is that it is preventable. Avoid both. Stay away from secondhand smoke as much as possible. If you need support, do not hesitate to ask your healthcare provider. Help is available. If you are supporting a pregnant woman, please try and create a safe and healthy environment for her. If this video was helpful, follow Caregiver Nigeria Society for more helpful, reliable health information, and also share to your loved ones who may need it. Thank you and see you in the next video.